grotesque limbs that grow out of control.
And it totally took me by surprise. It just shocked me.
The mystery of overgrowth syndrome.
When I first saw the pictures of myself as a child, the term circus freak shot to mind right away.
Born with a face of stone.
People would ask what was wrong with me, and I'd have to tell them.
A life without expression, unless surgery can put a smile on this teenager's face.
I had to wait 8 years for my baby's first smile.
The amazing Bionic Hand. And
there's blood everywhere.
Back from the dead, a 1,000,000-to-1 complication puts 2 lives in peril.
She's dying right in front of us.
A medical miracle in the labor room. The most incredible species on the planet is human. A 100,000 genes make up the human body. Genes carry the code that programs how we grow. If just one gene is defective, the results can be catastrophic. Here are 4 of the most extraordinary genetic conditions known to man. Her hands resemble the claws of a lobster. Ectrodactyly is an inherited syndrome. Kathy Stiles was born with 2 fingers on each hand and grossly malformed feet.
In the most severe manifestation, it's also known as a lobster claw deformity, so that instead of having 5 digits on your hand, you would have 2 that are divided in this way.
It runs in the family. The Stiles history of lobster hands stretches back 150 years. Kathy's ancestors became famous sideshow acts.
He had a banner made up of father and daughter. It mainly would be my father and I sitting on the platform. He would give the spill of how many generation it was, what it affected. He used to sell little postcards of him and I. They asked questions if they wanted to, then we answered them.
30,000 genes make up the human blueprint. A defect with any of those genes may remain dormant for generations. One of the cruelest gene mistakes is the terrible aging syndrome, progeria. Ori Barnett is only 8 years old, yet he inhabits the body of an elderly man. It's a 1 in 8 million genetic tragedy.
One single letter in the billions of letters that make up our DNA has changed. And this single letter change creates the entire disease process known as progeria.
You okay?
Progeria's victims age 7 times faster than normal. They suffer heart disease while they're infants. Their skin is stretched so tight, it hinders their breathing. And tragically, they can expect to live not much more than 13 years. More tragic still, genetic disorders that snuff out life a few days or weeks after birth. Baby Ryan Gonzalez was born with harlequin ichthyosis, a genetic mutation that creates skin so deeply creviced it can't keep fluids in or infections out.
It's so severe that the skin is often cracked down to the meat.
Miraculously, Ryan is one of few who survive this genetic killer. Now 19 years old, doctors have to improvise Ryan's ongoing treatment because no one expected him to live this long. Sometimes the body literally imprisons itself. This is the skeleton of a man whose muscles turn to bone and whose bones literally fuse together, turning him into a motionless shell. And it's not just a thing of the past. 19-year-old Sarah Steele is a living example of this genetic aberration.
I'm very restricted on what I can eat. I can open my mouth about this much.
FOP is a progressive condition. Sarah is facing a future where her muscles and bones will become more and more frozen. She will become a captive of her own body.
FOP is a catastrophic sabotage of the body's skeletal system.
Scientists continue their search for ways to avert genetic conditions like ectrodactyly, progeria, and harlequin ichthyosis.
Unfortunately, for many genetic diseases, we do not have cures. We're beginning to understand what goes wrong, but we don't know how to fix them. Learning to fix genetic disease, of course, is the holy grail of the geneticists.
Meanwhile, for families who carry these mutant recessive genes, life is a game of genetics Russian roulette.
Yeah, it's all going to be the same.
This is video of mother-to-be Paula Maestas, taken minutes before disaster. Days earlier, a healthy 32-year-old Paula, very much overdue, was waiting for her second child to be induced. On the morning of May 5th, 2004, she checked into St. Joseph Hospital in Denver, Colorado.
Okay.
I'm gonna have a 15-pound baby.
The couple joke as Paula's husband of less than a year, Richard, records the happy event on the family video camera. Paula's doctor was veteran perinatologist Dr. Al Haverkamp. He didn't foresee any problems for Paula or her baby.
Hey, I've done about 20,000 deliveries. I ought to be able to do your delivery. I didn't know I was jinxing myself by saying that.
You look beautiful, though.
Thank you, Eddie.
Paula and Richard have no idea those could have been the last words they'd ever exchange. Not long afterwards, the birth was induced. Paula was experiencing her first contractions, but suddenly, she felt her airways constrict. Paula could no longer breathe.
She said it again, hello, I can't breathe. And then by that time, there was nothing, there was no more, she wasn't talking anymore.
Miraculously, nurse Horace Berger was still in the room.
I tried to feel for her pulse and I couldn't. I didn't feel it.
Paula's heart stopped beating.
I look over at my mother-in-law and I hope I never see that look on her face again. It was
just knowing something was wrong and not a clue what.
The nurse raced for the Code 0 button. Code 0 means a patient is about to die.
OR 15, core 0, OR 15, core 0, OR 15.
Staff converged from all corners of the hospital.
People began pouring into the room. It was like they were coming out of the woodwork.
And we kept getting pushed farther and farther back. They kept asking us to leave, and I said, I'm not leaving.
Paula's doctor, Al Haverkamp, was nearby with fellow obstetrician Dr. Sally Berga.
We ran over to see what was wrong with Paula, and she clearly wasn't breathing. She had a lot of foam coming out of her mouth.
She was gagging, bluish. She had a good pulse, but was not breathing very well.
Paula's vital signs were shocking. She was dying.
I was so shocked at what was going on, I think. I was on one knee again. I went in and immediately kissed her and grabbed her hand. And I was on one knee just praying.
By now, the operating theater was mayhem.
It was a madhouse. They're pumping on the mom's chest. They're shocking her.
Literally within 2 minutes, probably 25 or 30 people were in the room to help respond to this emergency.
An ultrasound showed what was happening with Paula's heart. It was trying to pump, but the left ventricle kept filling with blood clots.
The right side was dilated, was huge. It wasn't pumping very effectively at all, which means something was blocking flow.
Paula's pulse rate soared dangerously to more than 160 beats a minute. Her blood pressure was plummeting.
I mean, she's dying right in front of us.
Paula stopped breathing. She'd suffered a deadly embolism. An embolism occurs when a blood vessel becomes obstructed. When blood products clump together, they form clots. tightly packed blood vessels in the lungs become congested. Eventually, those blood clots reach the heart. Paula Maestas had experienced an amniotic fluid embolism. It occurs in just 1 in 80,000 deliveries. Of those, 9 out of 10 mothers will die, and most of the babies they carry.
One of the worst things that happens is you have a dead mother and then a brain-damaged baby out of the thing. That 50% of the babies are either brain-damaged or die.
Paula's embolism was triggered by a leak of her amniotic fluid. Through a rupture in the amniotic sac, it entered her bloodstream. Paula was one of the rare few who had a massive allergic reaction to her own amniotic fluid. Her body went into anaphylactic shock. Her bronchial tubes constricted. Her breathing stopped. 5 minutes had elapsed since Paula first stopped breathing. She was dying, and her baby was at risk. Dr. Haverkamp and Dr. Berger began a rapid emergency cesarean section. There was no time for prepping.
We didn't do any draping. We just left her completely unclothed so we could see what was going on with her heart.
We got the baby out in a few minutes and handed the baby off, and we could see initially the baby was quite blue.
A baby boy had been delivered in just 6 minutes, but still Paula's blood kept clotting. It was turning into jello.
When the amniotic fluid, which is the fluid that surrounds the baby, when that gets into the mother's bloodstream, it causes a massive clotting. So basically all the blood in the body clots in place.
Paula's heart could barely pump the jello-like blood. Death was now very close, but worse was to come. A second terrible stage of amniotic fluid embolism was imminent, and it would push Paula to the very brink of death. Only a miracle could save her.
About that time, Paula went into a cardiac arrest, and the C-section incision wasn't bleeding, and she actually had her heart stopped.
Against terrible odds, Paula was hanging on to life until a second catastrophic stage of amniotic fluid embolism began. Paula began hemorrhaging massively from every part of her body.
They bleed from all orifices, eyes, ears, nose. There's blood everywhere.
Every incision, every bump and bruise starts bleeding, and she was bleeding massively.
All Paula's blood clotting factors had been used up when her blood turned to jello. Now her remaining blood could no longer coagulate, and nothing could stem the bleeding.
The blood doesn't coagulate at all. It uses up all of the properties of coagulation. So, I mean, you're compounding everything by suddenly having this profuse hemorrhage.
Doctors began to pour huge amounts of plasma and blood clotting compounds into Paula, but Paula's life was slipping away.
I made several calls after that to friends, asking them to pray, telling them that Paula was very, very ill and that we might lose her.
Meanwhile, neonatal staff fought to keep baby Ricky Maestas alive. Traumatized by what had happened in Paula's body, his chances of survival were rated as 50-50.
Someone came up and said, "Would you like to go see the baby?" I'd been so focused on Paula, it was almost kind of a shock to think, oh, the baby's here. So we went to the neonatal intensive care unit, and I got to see Ricky for the first time.
All right, this is Grandma's first time to feed him, isn't it?
While Ricky's condition was monitored by the minute in the neonatal ICU, Paula was still fighting for her life. And then doctors noted something very rare. There was an unusual swelling in her abdomen.
We noticed that there was blood in the upper abdomen. We don't normally see that. I've never seen it before.
Perplexed, the surgeon decided to reopen Paula's cesarean section to see what was going on. They were astonished to find more than a gallon of clot-filled blood accumulating in Paula's abdomen. When they drained it, something miraculous happened. With the clots removed, Paula's blood suddenly began thickening. Somehow, she was pulling through the crisis on her own.
And what followed next was actually quite remarkable. She didn't experience any of the usual complications that we see from someone who's gone into shock, been resuscitated, received massive amounts of blood and blood products.
Against every doctor's expectation, and despite almost every case of amniotic fluid embolism, Paula Maestas had pulled through. Of the 10% of women who survive an amniotic fluid embolism, most are left brain damaged. Not only was her brain fully responsive, Paula's body continued to recover astonishingly quickly.
It was something that the entire hospital here at St. Joe's knew about and knew that something special happened, something different happened.
A day later, she was talking and holding her baby. I mean, it really was amazing and a miracle.
She fell asleep.
This is video of Paula holding little Ricky for the first time. After a few days, she was doting on her baby just as every new mother does. Paula's recovery was simply unbelievable.
It almost defies your imagination. It's just beyond your expectations. You take a look at her, she's bright, she's alert, she's got beautiful blue eyes, you know, and you just say, wow. You don't know where you've been, you know. You were, and here you are.
A week later, Richard videos Paula going home from the hospital. And this is Paula and Ricky 6 months later. A perfect baby and a healthy, happy mother. Incredibly, Paula has no memory of what she'd been through.
It's all really a fog. I don't really remember. I remember a lot of them coming in and just saying, you know, wow, you look good, and really glad to see that I was alive. I didn't really realize the whole magnitude of what had happened until, I would say, a week after I came home. They told me that 90% of the women die, and out of the 10% that live, only 1% live neurologically intact. Again, it took me a long time for that to sink in. So later, as I started looking at the magnitude of it all, it was very emotional.
Ricky is a perfectly healthy baby. The only sign of his trauma, a tiny scar on his shoulder where he was nicked during the cesarean section. For husband Richard, the thought of what he almost lost remains traumatic.
We had only been married not even a year yet. We almost didn't make it to our first anniversary. Stuff like that just messes with your head. You remember calling people and saying, she may not make it. And then it was so great to say, she's talking, she's responding, you know?
I'm so grateful. I'm very grateful. How do you thank someone who saved your life? You know, how do you thank so many doctors that stayed by your bedside all night long, keeping you stable and keeping you alive? Just thank you just isn't enough.
Medical miracles occur in the OR every day, but surgery is not a perfect science. 20 million Americans will have an operation this year. A mistake in the OR will affect more than 500,000 of those patients. Here are 3 examples of where surgery goes badly wrong.
Just imagine something this size and shape being left inside of you for 2 weeks. Unbelievable.
Studies have shown that a surgical tool is left inside a patient once every 15,000 operations. Dawn's ordeal began when surgeons removed a massive 13-pound abdominal tumor. 2 weeks later, working in property maintenance, Dawn was still experiencing excruciating pain. But this pain was different.
I'd go to bed at night. The next day I'd wake up to take a couple steps to the bathroom. I'd go, oh, what is that? And I could feel this stabbing pain in my chest.
After a month, Dawn had a CAT scan. He thought the cancer was back. The real source of the pain was a complete shock.
About 30 seconds into it, she stops what she's doing, comes over and pulls me out and says, "Do you have any metal in you?" And I'm thinking, my keys, my wallet, my belt buckle, everything's over on the table. No, why should I? I don't have any metal in me.
The CAT scan revealed a 13-inch metal retractor embedded in Dawn's abdomen.
Every doctor and nurse comes down the hallway, and when they first see this reaction of this tool, it's a 13-inch, 2 inches wide, stainless steel, malleable retractor. All their jaws go, "Oh my God, how in the world could this have happened?"
Dawn settled out of court with no admission of liability. New innovations like barcoding to keep count of every surgical instrument are working to prevent accidents in the OR. But in addition to having a retractor left inside him, 41-year-old Dan had an even worse complication. A bacteria was eating him alive.
So they got in and everything that was solid had liquefied. So instead of cutting with a knife, they just sucked everything out with suction.
The bacteria are resistant to all drugs. 1 in 5 people with this condition will die. There's only one thing it responds to. Twice a day, the nurses packed his gaping wound with gauze rolls soaked in Clorox. The wound had to remain open the entire time to prevent the bacteria from returning.
It was horrific. I mean, it was like looking at something from a gory movie. You know, I mean, that's, you know, here's your friend, and he has an open wound in his abdomen that, you know, you could put both your fists into, that, you know, extended and into, you know, even further back than you could see.
Dan's gaping wound remained open for 8 months. Dan filed suit and was awarded damages for the retractor, but not for the abdominal infection.
There are so many different ways that things could go wrong, you almost can't think of all of them.
Mistakes are only made in 3 out of every 100 operations. But even the easiest of operations can become a nightmare if the patient is awake. In 1998, Carol had an eye removed following years of corneal erosion syndrome. During the operation, her anesthetic failed, and she was awake the whole time.
The surgeon kept saying, "Cut deeper," and I thought, wait a minute, this cut deeper, they're just starting. I was awake as I am right now. And so I tried to move my body, I tried to talk, I tried to blink, I tried to move my fingers, my arms.
A paralytic drug prevented Carol from signaling her distress.
And the surgeon is saying, you have to pull harder. It takes a lot of force to get an eye out. You have to pull. And I'm thinking, God, this is more than I can bear. And the light went out, and that I knew that that's when they had cut the optic nerve.
Carol's eye specialist, Dr. Roy Rubenfeld, didn't perform her traumatic eye operation and could hardly believe her story.
It sounded, this story that she was telling me sounded like something out of a Hannibal Lecter movie. But it was real. The surgeon is not the person responsible for keeping the patient appropriately anesthetized, but surgeons should be aware that this is a possibility.
Awareness during surgery occurs 1 to 2 times per 1,000 operations. Many anesthesiologists now monitor brain function during surgery to measure the level of unconsciousness in the patient. Accidents in the OR can never be completely eliminated, but new technology and practices are eliminating the worst case scenarios. Imagine going through life without ever being able to smile.
And you're expecting them to smile and they're not. It's a little bit difficult.
A life where you can't express any emotion.
People would ask what was wrong with me, and I'd have to tell them.
Where your face is frozen forever.
It's very rare, but it means that he won't smile.
The operation that might put a smile on his face costs $70,000. The dilemma is, how much is a smile worth? Mobius syndrome is a genetic condition. It literally means dead face.
Mobius syndrome is a syndrome in which certain of the cranial nerves basically don't form either at all or completely.
Facial expression involves a myriad of muscle actions working in unison. It takes 5 to 54 muscles to form a smile. Humans develop up to 18 different smiles. Women smile more than men. The very act of grinning releases endorphins that make us feel better.
Impulses coming from the brain and going into muscle is an amazing phenomenon when it works appropriately, and one that we take for granted completely and forget what a mystery it is.
14-year-old Sean McCarroll's face has never displayed any emotion, and it never will. Sean was born with Mobius syndrome. Mobius is incredibly rare. It has robbed Sean of the experience of smiling, frowning, in fact, any facial expression. His is a face of stone. When he was a baby, Vicki McCarroll didn't know what the problem was.
All I knew was that my baby wasn't eating. I didn't know what was wrong. He couldn't breastfeed, and I kept thinking that I was doing something wrong.
2 vital cranial nerves were missing or malformed. Sean's face was paralyzed. His neurologist delivered the bad news.
He said, yes, you know, your baby won't be able to blink, he won't be able to smile, he said, and he'll be stigmatized.
Studies have shown that nonverbal communication is a vital part of forming relationships. Vicki feared that Sean's Mobius condition would deeply affect his ability to make friends. It was a mother's heartbreak.
I can remember sneaking into his crib when he was a baby and looking at it and making him laugh and thinking, okay, well, today he's gonna smile. And then the next day, okay, today. And then finally one day I just realized, you know what, it isn't gonna happen, and that's okay.
At 14, Sean doesn't miss what he never had. For him, stone face syndrome is not a handicap. His face gives nothing away, but his personality is definitely out there.
I love to talk. There's nothing better feeling in the world than to feel these vocal cords move up and down.
Sean's very expressive. He doesn't show it in his face, but he shows it with his voice, he shows it with his body language, he shows it with his arms, he shows it with his head nodding.
When you're a confident teenager and happy with life in the big outdoors, Mobius syndrome doesn't seem like a big deal. But for a teenage girl whose friends have just started the dating game, having a face of stone can be a cruel handicap. Chelsea Thomas also faced Mobius syndrome's life sentence. Her mother, Laurie, was devastated when her baby was diagnosed.
It kind of sunk in that, gee, she's not going to have the social interaction that she should have. And people were starting to say, you know, when you go out places, they'd say, oh, come on, don't be such a sourpuss, smile. And, you know, I'd say she can't. And they'd look at me like, what do you mean she can't?
Laurie searched America for a surgeon who might be able to put a smile on her daughter's face. But her heart sank when she found out that a face-saving operation would cost $70,000. Her little girl would go through life without facial expression unless Laurie could find a way to pay for the operation. 16-year-old Chelsea Thomas was born with Mobius syndrome, a genetic condition that paralyzes the face. Without the cranial nerves that control facial movement, Chelsea could not smile or frown or make any expression. For a teenage girl setting her sights on college and boyfriends, life with a face of stone would be unimaginable.
Old
man. Okay. Only if they're cute though. Only if they're cute though.
She wants to date. She wants a boyfriend, and she's not, she's not finding somebody. And I think it has to do with kids in this age group. Physical has a lot to do with it.
People would ask what was wrong with me, and I'd have to tell them, but I did have like a couple people that teased me like every day.
If you don't smile, it's hard to get someone to know that you're interested in maybe wanting to go out with them.
When Chelsea was just 7 years old, her mother heard of a revolutionary operation that might put a smile on her daughter's face. But it was a parent's dilemma. The operation would cost a staggering $70,000. Invasive facial surgery might leave significant scarring. Chelsea's mind was already made up.
She wanted it. She said, Mom, I want to smile like you.
I really wanted to be able to smile so I could be like everyone else and show people when I was happy and excited.
Face-saving surgery would have remained an unaffordable dream until the Thomases were told their medical insurance would cover it. Chelsea underwent a complex marathon operation. She had no muscles to make her smile, so surgeons harvested muscle from her thigh. That muscle was attached to her upper face and her lips. It would pull to make a smile-like movement. But to control the muscle, Chelsea also needed sensation. Surgeons located another working nerve in Chelsea's face. Under a high-powered microscope, the tiny nerve was split. Half was left to do its existing job. The other half would eventually supply sensation to Chelsea's new smile muscle.
It's not an immediate movement that you see. In fact, initially there's no movement. And usually you see nothing for the first 8 to 10 weeks after the surgery.
2 grueling operations and many, many months of waiting later, 7-year-old Chelsea experienced her first smile.
She smiled for the first time right around her 8th birthday, so most mothers get their baby's first smile at a couple weeks. I had to wait 8 years for my baby's first smile.
10 years later, here is Chelsea's $70,000 smile.
The happiest place on earth.
$70,000 is a lot for a surgery, but people should be able to smile.
Another teenager with Mobius syndrome, Sean McCarroll, elected not to have smile surgery. As far as he's concerned, there's nothing to fix with his face.
Well, Mobius doesn't really set me back. I don't feel I need the smile surgery because, it's just like hiring a Maytag repairman to fix your dryer. It's not, I'm a person. I'm not, I don't need repairs. I don't need to, I don't need to be fixed, so to speak.
Hey! Whoa! I think he actually uses that inability to smile to his advantage because he's constantly making people laugh with his very witty, dry sense of humor.
It's the dilemma of Mobius syndrome. Incredible surgery can restore a missing smile. Question is, should it? Sean McCarroll's world is used to him having a face of stone. But for Chelsea Thomas, who's now beginning to play the dating game, her new smile is priceless. The day of the Bionic Man is here. Once the product of TV imagination, bionic technology is transforming lives for real. In Sydney, Australia, Mick Roffey is about to try the latest breakthrough in biomechanics, the Bionic Hand.
I really did think it was science fiction, to be honest. But for me, it means I'll be able to carry stuff. I'll be able to pick stuff off the ground myself.
Team designer Peter Abulfathy at the Royal North Shore Hospital has modeled the glove on the human hand's incredibly complex mechanisms.
We've got 15 joints in the hand, and there's no other part of the body that has that many joints. It's part of our communication as well as being so much a part of our function.
This is the first time the glove has been put to the test. After a car wreck left Mick paralyzed, he has nothing to lose and everything to gain. He can move his arm, but his hands and fingers are useless.
Really basic things like make yourself a cup of coffee, if you know what I mean. Like, they're some of the hardest things to do.
If the bionic hand works, Mick will regain the ability to do the everyday tasks he once took for granted.
I don't think you'd have much coffee left, do you? If you did that.
The thing I'd like most would be my fingers back, so I could do anything, like as in I'd catch a ball with my kids, I could play with them, could make a cup of coffee, I could eat me dinner.
This will go over your arm to house the motors, and then we just have to make the final adjustments for all the cables.
We're about to see what this complex network of artificial tendons can do. Tiny motors will reel in polymer threads, giving Mick his finger movement. That's the theory. But whether he will have enough grip to get this apple to his mouth remains to be seen.
Yeah.
The glove works.
You good? That's a big achievement. Well done.
This is a new high in Mick's painstaking recovery.
Is it worth it?
For now, the glove is controlled by computer, but soon Mick will control the bionic glove using a basic Palm PC. And one day the bionic glove will respond to voice commands.
We're going to see better devices working better over different parts of the body and helping people with different types of problems, not only in the hand, but in the knee, in the hip, etc.
The bionic glove is a godsend for the victims of stroke, spinal cord injuries, and a range of paralyzing conditions.
That's awesome, eh?
And better than restoring just their hand movement, it'll give them back their independence.
That's good.
You need help, you have to ask for help for everything. And with the bionic glove, you don't have to ask for help, you can do it yourself. So, to be honest, that means a lot, to me especially.
From the moment of conception, we grow from our own individual blueprint. But sometimes the plan goes wrong. Sometimes the body forgets when to stop growing. These harrowing photos are of a bygone era, but the condition that cursed the elephant man still exists here and now.
We don't know why the body is able to regulate us to be the exact size that we are, and we don't know why some people overgrow in some parts of their body.
3-year-old Devon has overgrowth syndrome.
Ah, cheese!
Parts of his body do not know when to stop growing.
It frustrates us when people just stare, in some cases whisper, and when it's an adult. Obviously, children are going to do that anyway because children are curious.
Devon was born with a massive growth on his side, an oversized right middle finger, and a lump of a left hand.
It looked like a starfish. Basically, his left hand looked like a starfish, and he had a large right middle finger. And I was like one of the first people to see him, and it totally took me by surprise because I had no anticipation of what was going on, and it just shocked me.
The doctors were also shocked and stuck for an explanation.
He told me that it was a bloody mass and it'll be a bloody surgery, and he may have to lose his arm, and he may not survive the surgery, and he was literally frightening me to death.
At 3 months, surgeons removed the growth on Devon's side.
So this is the first scar. It got pretty ugly down here.
At birth, it had been half his body size. But Devon's right middle finger and his left hand are still growing, and that has doctors stumped.
We don't know what the cause of the hand deformities are.
In spite of the obvious distress it causes, Devon's dressings have to be changed frequently.
Stand up. The bleeding that Devon has had since he was younger has been probably our main problem because of all the pressure that's in his left hand and in his arm. He has pebbling on top of his skin, which bleed on their own sometimes. And there's been a few occasions where it's been out of control.
His hand is bursting. Saving it from possible amputation has become an obsession for his parents.
I hope that amongst everything else, you know, besides living a very productive life, he can keep his hand.
I've never seen anything like this in your life, and having your first child, your first son, your first grandchild, to be born with that is really not fair.
Hold on, sweetheart. Let's turn you a little bit.
The doctors couldn't explain Devion's bizarre growths, so Sharon set out to find out for herself. Little did she know that one man with a similar condition spent his entire life searching for the same answers, only to make a shocking discovery. 3-year-old Devion is carrying the curse of overgrowth syndrome. Doctors have been documenting the condition for centuries. Hands and feet that won't stop growing. Fleshy growths on odd parts of the body. But medicine has yet to come up with a cause or cure for this genetic aberration. So Devion's mother, Sharon, decided to find out for herself.
As time went on, I started doing some research on it, and I learned a lot about it, but at the same time, it also scared me more because of the different things I was learning about this condition and all the associated conditions with it. So I tried to prepare myself and Edmund as much as possible, but at the same time, it still wasn't a lot of help because we didn't know for sure if this is what he had.
Overgrowth syndrome is one of the rarest conditions known to man. But by a sheer coincidence, just across town, another person is afflicted with the same monstrous symptoms.
For 44 years now, I've known something's wrong or different about me. For 11 years, I've been hard at a quest to find out exactly what that is. I would like to know sometime before I die what's wrong with me.
Gordon has an overgrowth syndrome. That is to say, this is not cancer. This is normal tissue grown to too great an amount.
It was a beautiful day the day Gordon was born. I was so thrilled that we had our second son. But he did have some physical problems that the doctors could not explain.
It was every mother's heartbreak. Her unborn son was deformed. A large mass was growing on his side. His feet were grossly misshapen and out of proportion.
We asked the doctors there, and they just simply said, it's a birth defect. We don't know what caused it. Just live with it.
At the time, doctors called it gigantism or elephantitis. They were wrong.
When the doctors first saw his feet, they suggested to us that it would probably be best to amputate the one because it would hamper him throughout his life. We said no. We felt there would surely be an answer somewhere rather than just cut his foot off.
The one thing doctors do know is that overgrowth syndrome is genetic. It's not something you can catch. It's something you are born with. As the growths get out of control, the only way to treat them is to cut them off.
Growing up, the issue of amputating either one foot or both feet came up often.
The first years of Gordon's life were just a blur of surgeries. Firstly, to remove the growth on his chest, and then to literally prune his feet back when they grew out of shape.
Hey, Mom, can you come wrap my foot, please?
Eventually, doctors were given no choice but to pare Gordon's foot back to the stump.
They basically took off the last 3 to 5 inches.
This is Gordon's own video of the amputation.
With that amputation, I can now walk without the amount of pain that I had to grow accustomed to.
The condition that was overtaking Gordon's body remained a complete mystery to he and his doctors, until one day Gordon was watching a documentary about this man. Joseph Merrick lived a wretched life in Victorian England. He too had an extreme overgrowth condition and has come to be known as the Elephant Man.
Elephant Man was diagnosed with Proteus syndrome in retrospect.
Then as I sat watching an Elephant Man special, They said that the elephant man, Joseph Merrick, was thought to suffer from Proteus. And as soon as I heard it, I said, Proteus, that's what he said I had.
Gordon decided to investigate his own medical history. When he retrieved his medical records from hospital, it was like holding up a mirror to a tragic past.
In all honesty, when I first saw the pictures of myself as a child, the term circus freak shot to mind right away.
He was seeing these photos for the first time.
First of all, this child, there's no way this child could still be alive. There's no way this child, having a tumor that size on his side, you wouldn't think that this child had a shot at life at all.
Gordon has not only survived, he's beating his condition into insignificance. Devion's mother also asked her doctor about whether her son has Proteus.
Mom had asked about Proteus syndrome, and Proteus is an extremely rare syndrome. About 1 in a million live births will have Proteus syndrome, but he's missing one of the hallmark features, which is the hamartomas, which are the benign lesions that these kids have. And he simply doesn't have that key element to have Proteus.
Hold on, sweetheart. Let's turn you a little bit, okay?
Okay.
Her search continued. The internet, medical libraries. Eventually, she found another overgrowth syndrome that seemed to match her son's symptoms.
What it actually does, and depending, it varies by child, but it can cause bone overgrowth, tissue enlargement, limb insufficiencies where some parts may not be there, it may have duplicates, and it can cause one limb to be longer than the other.
It's called Klepper-Trenaunay. This time, the doctors agreed she was onto something.
Sharon suggested the diagnosis of Klepper-Trenaunay, or KT syndrome, very early. He didn't have all the components, and so we were hesitant to give him the diagnosis, but for a lack of any additional diagnoses, that's the one that fits Devion best.
He was officially diagnosed by just my investigation of it.
Devion had 2 of the 3 key symptoms for Klepper-Trenaunay, and during this routine checkup, Dr. Norika makes a significant discovery.
One of the things that I noticed right here is that this vein has become a lot more dilated than it was when he was a baby.
Yeah, right.
And so it looks like he has all 3 elements of KT. This is the one element.
But a successful diagnosis will not quickly lead to a cure.
I think it's quite likely that the combination of genetics and what's known as developmental biology will unlock the mystery of these overgrowth syndromes such as Klepper-Trenaunay and Proteus syndrome.
While medicine tries to crack the genetic code of overgrowth syndrome, Devion has at least 2 things on his side: time and a mother who won't rest until those answers are found.
Sharon is a tremendous advocate for Devion, not just in a passive way. Even from the beginning, she has been out there, pushing, making sure that if there's a diagnosis to be had, that Devion had it.
For Gordon, the search continues. He has already offered himself as a living specimen to help find a cause and cure to overgrowth syndrome.
I'm astounded by the sort of buoyancy of his personality. This is a man who's obviously suffered considerably, both socially and physically because of the malformations that he has. And yet he has a great sense of humor, and he's a very positive outlook.
And just to prove that if you don't mind, pain doesn't matter. Gordon and Devion are making the most out of every day, while science does its best to keep up with them.
And it's hot. Oh.
That's a lot of static electricity.